Good morning and welcome back to Wellbeing Wednesdays, brought to you from the Tulane University Counseling Center. Happy New Year. I am one of your co-hosts, Shawna Foose. I'm a therapist at the center and joined as always by my lovely co-host.
Hi, I'm Dr. Jinaki Flint. Happy New Year. Welcome back, Shawna.
Welcome back.
I'm Dr. Jinaki Flint. I'm a staff psychologist here, and I am so happy to be back. I really missed doing this, and I really missed sharing with you guys. So welcome back, everybody.
Yeah, so this is our first episode of 2021. We're back to just give you all kind of a preview of what's going on at the counseling center and help everybody kind of get a start to this semester. So in that vein, just real quick reminder of some of the things you might want to know about the counseling center. Let me share my screen. So if you're new to Tulane, we want to let you know that Wellbeing Wednesdays air every Wednesday on Instagram and our YouTube channel. And if you follow Campus Health on social media, you can get an update every time we issue one of our new episodes. And we'll have them weekly all semester. On the Uptown campus, the Counseling Center is located in the Diebold Complex on the first floor. And the hours are Monday, Tuesday, and Thursday, 9 a.m. to 7 p.m. Wednesdays, 9:30 to 7, and Fridays, 9 to 5. And making contact with the Counseling Center is really simple. It's a matter of one phone call to 504-314-2277. And you'll speak with one of the lovely ladies on your screen. That is Miss Charlesetta Beck and Miss Belinda Avila, and they are at our front desk. And when you make that phone call, they're going to do everything they can to schedule you to talk with a therapist that same day. So, you know, we're going to try to make sure that we're talking to people in the moment as quickly as we can. So make those calls and you'll be connected and set up to talk with somebody the same day about the services that we have available. For this semester, most of our sessions are being conducted over Zoom, so we can all stay safe and we don't have to wear masks. It's really important in our profession that we be able to see each other's faces and understand how people are feeling and all of the emotion that comes sometimes with those interactions. And when you meet with us for that first time appointment, it's a consultation, and we'll talk with you about what might be happening for you and make some recommendations. We've got services, you know, individual therapy, we've got group therapy, we've got workshops, community engagement, lots of ways that you might find support through the Counseling Center. On the topic of groups, we have so many.
Lots of groups.
Yeah, what are some of your favorites on here, Jinaki?
Oh, the procrastination one.
Yeah.
I might need to sit in that one.
Right, me too. We have the new to Tulane support group. That one's geared toward our spring scholars or our transfer students. We have the dissertation support group. So we have some groups geared specifically toward graduate students, if you're a graduate student, and you know, so many others that might be a fit for you. So when you have that first consultation appointment, you might be able to talk with the clinician about groups that would be a good fit for you.
Definitely. A large amount of groups.
Yeah.
Oh, my fave.
Yeah. So I wanted to kind of open us up for a conversation here around this new year and acknowledge, I think, that there was, for some people, a mindset that we were going to leave 2020 behind with all of its problems and tragedy and heartache, and that 2021 was going to be different. And 2021 is upon us, and I guess it's different. Maybe it's not, but so many of those problems just haven't gone away and haven't resolved. Sonia Renee Taylor, who you see on the slide, she is a poet, a spoken word artist and author, a social justice activist. a humanitarian and an amazing speaker. And she said this not too long ago. She said, "We will not go back to normal. Normal never was. Our pre-corona existence was not normal other than we normalized greed, inequity, exhaustion, depletion, extraction, disconnection, confusion, rage, hoarding, hate, and lack. We should not long to return, my friends. We are being given the opportunity to stitch a new garment, one that fits all of humanity and nature."
Sonia Renee Taylor.
Sonia Renee Taylor. Her ability, I think, to put language around this experience, I think, is so remarkable and powerful. And I think, you know, we've talked a little bit, you and I, about hope. And I think, you know, she doesn't use the word hope here, but she does use the word opportunity. And that, to me, resonates, given all that we're experiencing today.
For sure.
Yeah. And I think we want to, you know, just kind of give our students a chance to kind of sit in this moment of a new beginning, new semester, new year, and really notice these opportunities.
Yeah. Coming into another semester, transitioning, you know, thinking about what it will look like. I mean, even for everyone, campus wide, you know, coming back into 2020 part 2. You know, some of the same things are here. And I like to say that, it's not all pain and despair. It is joy. And sometimes it is being hopeful for the future. You know, we have many reasons to also be joyous about what's happening here. You know, we have a changeover in our government. We have a vaccine that's here. Hallelujah. So, you know, that tells us that people are diligently working to put COVID-19 in our rearview mirror. You know, and so there's a lot that's also happening around us for which we can be grateful. And I think there are a lot of people who are working towards humanitarian efforts. And we're seeing a lot more of that. I mean, just to look at, out of chaos, there is life.
Yeah.
Right? Earth was created from chaos, a big bang, right? And all of what sifted down became the pale blue dot, to put it in the words of Carl Sagan. Dating myself. That pale blue dot that we call Earth, that we live on and we get to be humans on, right? Came from that. So out of all the chaos that happens on Earth, it creates also beauty, because people adapt and they create new things and they refuse to perish or give up or die.
Yeah, I think, you know, it's important to acknowledge that living through this, we're in the 10th or 11th month of the pandemic, and the fight for racial equity, the government trying to change administrations, and the violence that's coming with some of that. And, you know, it's really tiring. If you're feeling fatigued, it's because your mind is managing this influx of information, a lot of it chaotic, And so I think I just want to kind of validate that for folks that it, you know, there is fatigue with this, and we have to really, really take care to rest our minds, restore our bodies.
Restore the body for sure. Restoring to a state of calm, right?
Yeah.
To a state of peace. And there are ways in which you can do that. You know, we will partner with you on that. Um, you know, you can get yourself to the counseling center, right? And learn some of those techniques, some of those skills. That's what we're here for. You know, I always say, you know, I don't really, you know, I talk about myself as a therapist, as a profession. I'm a psychologist, right? But I'm really a therapy partner with every client. You know, that client has chosen me to be their partner, and they're saying, "Here's where I feel what I feel is missing here. I need to learn this skill, right? In order to help me to thrive on campus, not just survive and scratch my way through, right? But I need to really thrive and get to from freshman year to senior year, from sophomore year and so on, right? Or to get through senior year and get over my fear of adulting, right? That happens a lot too, right? So whether it's transition adjustment coming in, right, from high school to college, or from senior year to life in the workplace or life in entrepreneurship, wherever you land, there's in all of the stuff in between, you have to deal with environmental changes and shifts, pandemics, you know, insurrections, all these different things. But you still have this, your own life that you're dealing with too and adjusting to. And so coming to the counseling center can be a very first good stop, right? A first line to help you just gather some of those skills. I really like to say too that you don't really have to have, you know, this chronicity. I think people feel like they need to be like just overwhelmed and just, you know, like just real bad to just happen to come in. You know,
not true at all. Come in even if you're feeling mostly okay, but would like to explore what therapy is like, or would like to explore one of our groups if you're interested in one of the topic areas like mindfulness. Yeah.
That's why groups are very important. I cannot say enough about the wonderful array of groups this year. I mean, Jen Keat was the group's coordinator, and then she has passed that baton on to Catherine Herzog. And I mean, and Catherine will now be hosting this whole array of groups, and they have just done wonders this semester. And when I say that, you don't really, you know, you don't have to be like, oh my God, I need therapy, right? Sometimes you can just get a group and learn something or be supported in something. Sometimes you just need that support, somebody to say, hey, yeah, I get that, right? And here's some things that I want to do to support you, because we're here for that. So coming to groups, it's a great way of kind of figuring out whether or not you want to deal with the therapy piece too in a safer way for you. You know, you'll be around people. Some of the groups don't even require you to really share that much, like mindfulness skills-based groups, things like that. You're learning skills, right? And so I'm always a fan of what we offer here, because I know that, you know, the transformative work that gets done, but also to let students know that what you're thinking is true about it is probably in need of some sharpening, right? In terms of what it is that we actually can do for you. So come through.
And you know, start with that consultation appointment. That first appointment is one-on-one with a clinician, where you can kind of talk about all of those things, the different types of groups that are available, what might be a good fit for you, what might not, you know, individual therapy, how that might fit for you, you know, if there's something you feel like needs your attention in that area. That's what that consultation appointment is all about.
All about. And it's no obligation. Like, no one's going to force you or even try to convince you. I mean, of course, we are professionals. So if we feel that there's safety issues or there's a real need, we will have that consultation with you, which is why it's a consultation. But it's not like, we're going to say, you must, outside of those things. It's not like, oh, well, you have to come here now. You've come to the consultation. It's not at all like that.
I always tell students I meet with in those consultation appointments, at the end of this, I'll make some recommendations. And by the time we wrap up, we'll have a plan.
Yes.
Maybe the plan is you're good and you're going to, now you know where to find us. Maybe the plan is you're going to plug into one of our groups. Maybe the plan is you're going to come for a few sessions of individual therapy.
Right.
Lots of options.
Maybe you just want to think about it and get back to us.
Right. Maybe we'll reconnect in a follow-up consultation just to kind of
for sure,
how things are going. Yeah. So one size does not fit all at the counseling center, but we're really good at helping find the right fit. That's one of the things that we do all the time and we believe in. So.
And from a varied standpoint, we have a really, I'm really proud of the diversity of our staff.
Yeah.
And there are like 4 or 5 different languages spoken in here.
Yeah.
This center has really gone through a great, perfect.
There's our team. There's our team. Yeah.
There's our team. Look at everybody. Hey, everyone. Yeah. So that's also a real big plus. I know, when I was back in those days, when I was in college, I would never go to my counseling center. I just would not have felt safe.
Yeah.
But here, I think that over time, we have really worked very hard in this center to bring, we've listened to our students, really, we heard what they said, and that's really great. I mean, kudos to campus health, to, the director Donna Bender, Dr. Bender, who was the director of the counseling center. She's gone now. But just wanted to just shout that out because, it takes time and effort and everybody to be really pulled into it, And so, we have, as a part of campus health, I'm very proud of what we have developed here and under the leadership of, campus health and our own leadership team, Matthew Savesky and Lindsay Sutter.
Yeah.
Shout out. To our team, right? Here, who is really, stood in and what we're building here is really great.
Yeah, I think it's such a collaborative effort of all of us on staff whenever we do have a job opening and we're looking to hire, and we all really prioritize, that we want a diverse staff. We want people from lots of backgrounds and cultures bringing their expertise and their knowledge to this work. And I think it's really evident in the team that we have now. It's really exciting. And the leadership that has been at the helm of all of this is remarkable.
Yes. Steering the course.
Indeed.
Steering the course.
Jinaki, I want to go back to the Sonia Renee Taylor quote. Okay. And this idea that we have an opportunity to stitch a new garment.
Yes.
With so much happening in the world, with the fatigue that some folks are feeling, this, starting a new semester under the precautions for COVID, what are some ways we can, help our students to feel like they're a part of this opportunity, this stitching this new garment? How can we do that for them?
Oh, that's so contextual because it's going to vary by each student and what their needs are, what they know to be true, right? And really, being able to help students attune within their own bodies, right? Getting into their own space, getting those mirror neurons activated, the social engagement system of bonding and connecting, right? That one is responsible for that. But just really helping students to really embody the vessel, their own, human vessels. And that really does, that's contagious. When you are more in tune to yourself,
Mm-hmm.
you are way more in tune to other people and attuned with other people as well. And so I think that part of it for me is having understood the transformative power of embodiment within my own vessel, and how transformative that is. Um, and to really, just work with students. Like I said, being a partner to students, not putting your thing there, right? Um, but finding out, meeting students where they are. So creating that own attuning with people, right? These are human beings that are coming to see, not subjects, not something to be studied, you know. Um, these are human beings that are coming to us for help, and we have a responsibility to them, that requires us being fully embodied or working our own work, right? Doing that work.
Yeah, you took the words out of my mouth. I was going to say, as helping professionals, we more than anyone maybe realize how important it is that we take that time to go inward, connect with our authentic self, calm the body. That self-care, which is such a little catchphrase in the world now, that self-care is part of what then prepares us for our day and for connecting with others, meeting them where they are, understanding them with empathy and non-judgment. And if we're going to stitch this new garment, we have to do that with empathy and non-judgment, I think.
Yes, that's the mindful way.
Yeah.
Yeah. We have to be aware, paying attention, purposeful attention, right? Without judgment, or reducing it, learning how to chip away at that, learning that you don't have to give everything that you feel, that you think a story, because thoughts are generally not even, right? Trying to steer you in a direction. It's getting lost in the sauce, so to speak, of our thoughts, right? Bringing that into, I like to say, don't run from them. What are you thinking? What are some central themes that are there? Because it has a lot to tell you. The communication with the body is so amazing to me. Like listening to it, having that conversation with it from a sensation, a sensory perspective, and a feeling perspective, understanding that. One of the things that we can do here is, give you emotional literacy. Oftentimes people just don't have that, it's really difficult. And it feels weird when you can't name something. So we say, like, let's not give it a label, but sometimes you don't even know what you're feeling.
Right.
So you have to be able to identify. So we're not judging, we're just identifying.
Yeah.
Right? So you identify what it is, but it doesn't have to mean something is wrong with you. It doesn't have to mean that you have some character flaw or something like that. It just means that this is where we're at in this present moment.
Right. And sometimes experiences we're having or emotions that we're feeling that feel uncomfortable or bad really just need language around them to kind of validate the feeling. I think that's why I love that Sonia Renee Taylor quote, because she just wrapped some language around this experience in a way that I hadn't been able to articulate for myself. And so, you can look to others to kind of help guide some language. That's some of the work in therapy. We use our words to try to understand the experience. And sometimes just that alone kind of soothes that pain or suffering.
Yeah, yeah, I think we all can attest to that. Like I talk to therapists all the time, and oftentimes it's emotional literacy. Sometimes just knowing it is
Yeah.
like, oh, is that it? you know, or sensory literacy. I've had people to finally feel something in their bodies through the
Yeah.
work and go, oh, this
There it
is what's
is.
happening.
There it
Wow,
is.
that felt good. Like,
Yeah.
or wow, that feels weird. Just the knowing that,
Yeah.
oh, this is where I carry that,
Yeah.
right?
And connecting.
Yeah,
Right.
because that stress is just, it just creates stuck energy in the body, you know. So sometimes just putting, we call it putting you on to it, creating an awareness, taking it from the unconscious or subconscious into consciousness. Because a lot of what happens in the stress world happens below consciousness.
Right.
So taking that and saying, okay, let's pull it up. Let's bring it up on screen. Let's out it, into the world.
Yeah. And that thing that might feel so big under the surface, sometimes when you bring it out in the light, it kind of
Yes.
shrinks, power lessens. Um, I've seen that happen many times in therapy. And
Yeah. That's so beautiful. It's and I still have those kind of what Oprah calls aha moments. I still have some of those moments sometimes because it's a journey, not a destination, right?
right,
And so I'm like, what was that?
look at that.
Oh, that's this. Oh, okay. Now I know what to do, right? But you can carry that for like a week or something. Like, you can carry that and go like, what is going on? Why is my neck hurting? Why is this, right? Because your body's communicating. It's saying, hey, knock, 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 something's happening. I need you.
Indeed, and we must tend to that, or it just
Yeah,
knocks harder and beats the door down.
for
So
sure.
taking the time for that for you then better prepares you and positions you to maybe go outward and be with others, connect with others
Yeah.
authentically. Yeah.
And use your discernment when you're around others too. Like you can read the room better. you
Keep
know.
your radar
Um,
sharp, right? Yeah.
right. And really connect interpersonally
Mm-hmm.
with
Mm-hmm.
others. Because sometimes that happens. Like I know when I'm really feeling like irritated or feeling what the kids say some type of way, uh, I don't. I tend to isolate. I want to be around people, right? And that's when I know, oh, what's happening,
Mm-hmm.
right? It's a clue.
Yep.
And then you say, oh, okay, no, that's when you more than likely need connection. Right? So yeah, so it's about really reading, being able to read yourself.
Right. Know your tendencies.
Know it.
Know what those signals might be trying to tell you. Yeah. And then as you continue on your journey, the roadmap might be a little more clear, have
Right.
more road signs along the way, and then you can
Yeah,
proceed. Yeah.
exactly. And I
So
like
go ahead.
no, I was saying I like to use myself often as an example because it's important to be humanized. I think there's a thing in therapy where people think that we're supposed to be these kind of, our emotions are turned off when we start therapy. We're just sitting there like, okay, well, you just tell me this, and I'm just going to be the robot in the room. Like,
Right.
like nothing can be further from the truth. We're human beings, right? We're just trained and we have ethics, right? So that we care for folks, we do no harm, and we hold the space for you, right? We do that because we are human beings, not
Yeah.
because we're not.
Yeah.
Or
It's
we're performative, right? It's not performative healing because that's unacceptable.
agreed. Agreed. And we have to practice a lot of what we preach. We have to tend to our human.
Absolutely.
We're in
Beautifully
this
stated.
world too. We're a part of this world. We're living through COVID. We're living through racial injustice and confronting our part in this culture. You know, we're doing that work ourselves in order to be the professionals that are here for others. Yeah.
Yeah. Yeah. I like the way you put that.
One of the ways I know you and I both take care of ourselves and help others is through mindfulness and meditation. And
love it.
me too.
My body loves that.
Absolutely. And I miss it when I don't do it, you know?
Mm-hmm.
So do you have a recommendation for our students listening today for a way to ground and maybe use a mindful practice? Can you share some?
I usually just start with telling students about breath and how important it is. And of course, if you have asthma or lung issues, respiratory stuff, talk to your doctor about using breath. I'm really big on that because I think people just go at breath and they don't kind of see the intersections of people. Like, these are human beings. Some people are not really going to be breathing like that.
Your breath, the way you
Right. Right.
Yeah.
And so I always like to give that as a disclaimer or as a care mechanism, you know. I don't like disclaimer because it seems like you're separating from it.
Yeah.
But to let people know, and the trauma informed one. So you always want to ask people if they want to do something, right? So the mindfulness doesn't start with just doing the act, but the mindfulness starts with you being mindful of the person in front of you as much as you can, whenever you can, right? So first it's like, okay, how am I mindful of this person, right? And for me, I'm like looking, you know, sometimes I'm like, okay, how am I mindful of this person? What do I know about this person? If there's too many unknowns, I need to ask. You know? So being mindful of who you're working with initially, that's the first step. And then I will start to talk about breath, the use of breath, because I think that's the gateway into the mindful space. And I always start with deep belly breathing. So I'll say, you know, take a deep breath in through the nose, fill the belly up with air, which means the belly expands, right? So that diaphragm gets to compress in there, you know, opening up air, going to and through the lungs, up to get oxygen into the brain. And then have a deep exhale, which is twice as long as the inhale. Exhale through the mouth initially, just to get the person used to doing that breath. Pulling the stomach in so the stomach compresses, and then emptying the lungs. That's that extra long exhale is really emptying the lungs so you can come back. I do it as a purse. Some people do, you know, I don't, hey, if it works for you, it works for you.
In yoga, there's the lion breath.
Right. The lions, yeah. That one. Although that one is an uptick. Like that one is mobilizing. So just taking that slow, deep breath, right? And also being mindful that sometimes the slow, deep breath, if the person is in freeze mode, you don't want them doing several slow breaths. You do want to come with a lion's breath. You want to mobilize. So you want to do really short, you know, breaths, not hyperventilating short breaths.
Right.
But so, which is why this is a practice that should be done with a trained professional. Now that was a choice. So, you know, sometimes, and it's not all the time, but definitely when people are in that freeze, immobilizing mode. So there's like these, sometimes you get really hyper aroused and you're kind of, you know, really anxious. And then there's sometimes you may feel a little more like, I just don't want to get out of bed in the morning.
Yeah.
You know, I don't feel motivated to do much.
Right.
I just feel like I'm stuck. Right. So that's not when you want to do those slow breaths. You want to really use the breath, because the breath can be real medicine inside of the body.
Indeed.
Right? And so you want to use the breath. So I always start with breath. And so inhaling, pushing that belly out, dropping those shoulders. Sometimes when people breathe, they want to hunch those shoulders up. So let gravity just hold those shoulders in place, right down. And then when you exhale, you're going to pull that belly in. lungs empty. That was a long exhale. Right?
Yeah.
And so you want to do that. And I always tell people too, if you go into a space and you've not done mindful or meditation before, and they ask you to do a 15-minute body scan, you might want to leave. I'm just saying. No tea, no shade to anyone else, but I'm just saying that is a long time.
Yeah.
If you have not done this before, your mind's gonna be everywhere,
That's
right? And then you're gonna walk away from it feeling like I can't do meditation. And I can tell you this because I hear it a lot. People say I can't do that because they've been in these rooms where people have tried to force them to do that, and they're like, oh, I can't do it. My mind is just too busy. When in actuality, I don't, and the mind is busy.
Yeah.
Right? And so it's designed to be busy.
Yeah.
So what people think is like, oh, that's not for me, or I'm bad at it.
I'm bad
right?
at it,
Right. But you're not bad at anything, right? And so I always tell people, one, breath, two, take your time.
Yeah.
If you can only do 30 seconds, do 30 seconds.
And it's worthwhile. It's valuable. It has an impact.
Right. Yeah. If you can only do a minute, do a minute.
Right.
Just take your breath and just notice it. And then notice when the mind's trailing off. Be aware of that. Because what people get confused is they look for, oh, bring your mind back, bring your mind back. So they're not even aware that the mind is doing it, right? They're like, oh, I got to bring it back because she said bring it back. And I've been guilty of that too. Just, it's okay. Just gently bring your mind back, to bring your thoughts back to your breath, things like that. But what I have learned is that it is, one, sometimes much better and easier if you're just aware that the mind has done that.
Yes.
And give that some honor. Right? And congratulate yourself for having a busy mind. And then come back to your breath. Right? So that's the thing. So there's a lot that goes into it. So you asked that question. But what I would like to do today is to just ask us to breathe. And I have a passage that I'm really fond of that kind of aligns with what you were talking about, stitching a new garment.
Yeah.
One of the reasons why I love this passage is because it just helps settle, and it informs your self-talk. For me. It just reminds us that we don't have to be turned back, looking back here in the past of all the stuff in 2020. And we don't have to be what ifing for the future, feeling anxious, anticipatory anxiety, right? About, oh, what could happen, right? What if this happens, right? But we can just honor where we are today.
Yeah.
Right?
Yeah.
So, yeah. So, do you want me to just share that passage, or do we want to do
through it? Yeah.
Okay, so I'll go ahead and share it now. Okay. All right. So I'll just ask that if you are following this webcast, to just notice your breathing. You can just breathe normally, following the sound of my voice. However you breathe in your own space is how you breathe. If you can do the diaphragmatic or deep belly breathing, pushing the belly out on the inhale, pulling the belly in on the exhale, just follow along and use your breath, and honor your brain and what it wants to do. All right, let's begin. I vow to remember that today is a new day, full of beginnings and fresh moments. Today, I will not cling to events of the past, but stay connected to what today brings. I will not blindly pursue my desires at the expense of others, nor flee from challenging tasks. I will remain true to the unfolding process of today, without losing myself in thoughts of what was or what might be. I will treat today with awareness and sensitivity, even in the most ordinary of tasks. I will apply myself wholeheartedly to the fullness of today. For I know that today holds the resource for authenticity in my body, my mind, and my spirit. Ashe. So that's today.
It's so beautiful. I
Hope you enjoy it.
That's wonderful. I want that printed and wallpaper.
I have to read it off. Be here today.
Be here.
Right.
Thank you for that, Jinaki. What a wonderful way to start this year, this semester. And I think it's a wonderful place to leave off today.
Yeah. So today.
Yeah.
Yeah. This is great. It's a great way to open up the season.
Yeah.
And again, Shawna, I'm so happy to be back with you. I missed you.
I missed you too. I'm
yeah.
so looking forward to today.
Yeah.
Every time I say the word now, I have like a soft spot.
Right. I'm looking forward to what we'll bring this season. We have I'm just so looking forward to all the stuff that we're going to be coming up with this season. This is going to be great.
Indeed. So follow us on social media. Follow us at Campus Health Instagram, on YouTube and Facebook, and you will be able to get these episodes when they're released every Wednesday morning. We'll have special guests. We'll have new topics. We might revisit some previous topics, but we'll be here every Wednesday.
Yes,
and we'll be
for
here
sure.
today.
Yes.
So with that, we'll sign off. Happy New Year. Thank you, Jinaki.
Welcome back.
Bye.